Hey, for anyone that's paid FICA taxes, have you ever thought, like, where actually is this money going, especially when it comes to funding Medicare Part A and Part B services? In this video, I'm going to walk you through, and also we're going to talk about the reality of what happens if Medicare goes away in a few years and why that could potentially happen in this video. Hey guys, it's Kelby Hightower with MedicareHub. I'm going to walk you through first the three funding paths of Medicare. I'm going to read over some notes with you so I can stay on point to kind of give you some guidance and educate you on how the funding of Medicare works, and then what are we looking at in the future if Medicare were to go away and why would it dissolve or become insolvent is the word we're going to use here in just a minute. Medicare isn't one program, so it's a set of parts, each with its own funding mechanisms. So I'm going to break this down to simplify this. So Part A, hospital coverage, is funded primarily by payroll taxes. So our payroll taxes, as we're paying payroll taxes, funds into Part A. Part B, outpatient and doctor visits, anything that falls outside of the hospital for Part B, outpatient procedures. Part A is hospitals, so think about a hospital itself and the physical attributes attached to that hospital falls under Part A. Part B is everything outside, from everything from diagnostics to doctor visits, specialists, outpatient surgeries, and all that's falling under Part B. So how is that funded? It's funded by the general Federal Reserves plus your beneficiaries, your premiums you're paying in for like Part B funds the Part B portion of Medicare, okay? So the general fund plus premiums that you pay in under Part B is going to fund that. And then payroll taxes is what's funding Part A. So the importance of that is Part D, prescription drugs, also funded by the general revenue plus premium. So if you're on a Medicare supplement, you're paying a Part B premium that pays in towards from the general fund, and your Part B premium pays into Part B, and that gives you access to have basically 80% of everything covered under original Medicare, minus the Part B deductible. And then you pick up a supplement, which you pay a premium for, and then you say, like somebody like us would say, hey, you need a drug plan in case you have a medication to cover your medication costs and reduce your out-of-pocket costs. You'd have a Part D plan. Well, that Part D plan is also covered by the general revenue plus the premium, the Part D premium. Most standalone drug plans have a Part D premium. Now, some of you guys may not know this, but your Medicare Advantage plan may have a zero premium, but in the benefits of that plan, it will allocate a premium amount that is being supplemented by the Medicare Advantage carrier and reduced. It's paying, in a sense, the Part D premium. So you'll see in the notes of your Medicare Advantage plan a lot of times allocating a $23.50 Part D premium. You don't pay that because the Medicare Advantage plan itself suppresses that cost. But there is a allocation that goes towards the Part D. So how's that paid again? The general revenue plus our premiums that we pay if we're on Medicare from disability, under 65 for Medicare disability, or if you're 65 and older and on Medicare, your Part B premiums you're paying to help supplement and offset the cost, plus the general revenue fund allocates the 80, and that goes towards your 80% of Medicare that doesn't cover, and then leaves you with a Part B premium and a Part B deductible, okay? And then Part D works the same way. So what's the big deal? Each part depends on different sources of money, and that impacts how vulnerable or sustainable each one of these are long term. I'm gonna go over in just a second how Part A is funded when it comes to the trust fund model, and then what we hear is called like insolvency of Medicare and why this is kind of thrown out there as Medicare is going away. I'll be back in just a second. So we're gonna pull up a screen here as I talk, and we're going to go over exactly how payroll taxes work when it comes to Part A. Part A is funded by payroll taxes, currently 1.45% from your employees, or the employees, and then 1.45% from the employers, with an extra 0.9% for higher income earners, okay? The money goes into the hospital insurance trust fund. So there's a trust fund that is entrusted to take the taxes and put in there, okay? So the hospital insurance trust fund, the only part of Medicare with a bank account, it builds up money when payrolls are strong and it spends it out on hospital services. But if more money goes out than comes in, we run into insolvency, okay? This word insolvency means elimination, basically. In 2024, the Medicare trustees estimated the Part A trust fund will run out of money and run short in 2036. Unless something changes, Medicare Part A is going to go away in 2036, okay? So this is the insolvency of Medicare Part A service benefits when it comes to hospitalization. Can you imagine if you don't have any hospital coverage and only have medical coverage, and you had a major catastrophic heart attack and go to the hospital, and 100% of the cost of that hospital sends a bill to you and you're having to pay it, where prior to, an allocation from the trust fund picked up the majority of the cost minus your Part A deductible. So coming in 2036, they're looking at Part A dissolving or becoming insolvent at that point. Now, here's the reality is we're going to talk about how and why that is not going to happen in just a second. So how Part A and Part D are funded is the budgeted model, okay? So we talked about the general tax revenue straight from the U.S. Treasury, and then also your Part B or Part D premiums that you pay in. So it is set up as far as money goes into the Treasury, or the Treasury has money allocated for Part B services, and then your Part B premium pays into that, and then out of that they're paying basically the 80% of original Medicare, or they have an allocated fee. This is where Medicare Advantage plans are paid in the sense of they have a contract with Medicare. Medicare allocates a dollar amount from Part A and Part B services to that healthcare company monthly, and they allocate coverage for Part A and Part B services. Now, the great thing about Medicare Advantage plans, just to simplify this, if Medicare Part A and Part B covers it, Medicare Advantage plans have to. It's mandated by Medicare to be equal to or greater than original Medicare. So sometimes people will say, well, Medicare Advantage plans don't cover everything that Medicare covers. Well, that's false. They have to. By law, they have to cover Part A and Part B services. Now, authorization, Medicare Advantage plans are going to require prior authorizations before certain surgeries, and the doctor usually gets involved and does that within days. But the reality is Medicare Advantage plans have to pay everything that Part A and Part B services cover. The government set a budget for these every year. If spending increases, the Treasury just pays more. There's no trust fund running dry. It's just the Treasury going, hey, we need to allocate more money. This is where you hear, they just scoop money out of one bucket and pull it over into the Treasury and pull money out of the Treasury into other buckets when balances of budgets are not happening. So in a balanced budget means, hey, we're operating on the money that's coming in and nobody's taking money and putting it into different buckets. The government does not work like you and I. In theory, what I make and earn pays for our bills at my house. At the Hightower home, my wife writes all the bills. If we ran out of money, I can't go over to a government bucket, or I can't even go over to my neighbor and say, hey, I'm low $5,000 this month. I'm going to scoop some out of yours, put it into mine. Later on, you can scoop some out of mine and put it into yours. It doesn't work that way, but that's how the government works. So in just a second, I'm going to dive back into something that's very important for you to understand when it comes to all of this that we're talking about today. So why does this matter? Well, funding equals stability. And guess what? All of us like to be stable. All of us want the peace of mind of knowing Medicare Part A and Part B are going to be around. Well, let's go over some important details when it comes to stability. And why should you care about how each part is funded? Because you can take part in the ability to vote and make your voice heard, because it tells us which part of Medicare runs at a higher risk. Part A has a risk running short unless Congress acts. So, insolvency going towards 2036, Congress goes, hey, we need to allocate funds towards the trust fund for Part A. And voters say, no, we don't want to do that. We want to allocate giving free health insurance away. And there's only so much dollars that can be put into certain buckets. And now all of a sudden we have the ability to vote people in office that begin to say we need to create a balanced budget or reconcile loss and spending over here, so that money that is being lost and just wasted can be allocated towards your Part A or the trust fund for Part A. So it's very important when we talk about minimizing and tariffs and all the stuff that we hear about right now. There's all kinds of spin on politics, but the reality is in our personal budgets, if we overspend, we have a spending problem. So we have to reduce that. And as I teach my kids, give, save, spend. Give 10%, it's God's, it's not yours. Save 10% and invest it. spend 80%, and if you'll do that, you never run out of money. And so the problem is we don't want to reduce our lifestyle or our spending, and we allocate politicians to vote and get in, and all of a sudden the spending goes out of control, and there's no reduction in the overhead. So at times, every year as a company, I sit down and look at the overhead of this business, and I reduce things that we're not using. Sometimes we allocate and start new automation softwares, and we just add some, and a lot of times it's not a lot, $50, $100, $200. But at the end of the year, sometimes I eliminate, come January, $1,000 of revenue that's just going out to stupid things we signed up for. Maybe it was a training site. Maybe it was some form of resource that we needed for 6 months, but we're not using now. So just being wise, and then you holding the government accountable to looking and going, hey, Congress acts on your behalf, on my behalf. I vote and my voice has a matter on the movement and direction of our country. Okay, so Part B and D will never run out of money, but your premiums and taxes will go up to cover them. So it's very important when we're seeing like reduced overhead creates profitability. That profitability can go towards covering Part B, Part D, and Part A services. It's very important to understand the importance of holding other people accountable when it comes to your money. If you gave your money to me and said, pay my bills, and your bills were $5,000 a month and you gave me $6,000, in 10 months, I should have $10,000 of additional money. The reality is the government doesn't run that way, and we as people have to step in sometimes and let our voice be heard. So it's important for you to be aware the insolvency is really a mythical myth, because the reality is it's never went insolvent. But what happens is Congress comes in, votes in, slides in some legislation, and boots it down the road, and they always have this doom setting out instead of 2036. As we get closer to that, you're going to see it's going to be pushed out further. And the reality is a lot of that can be resolved if we're involved in our local, state, government, national politics, and let our voice be heard. So I'm not a politician, but you need to be aware. You need to be educated of where your money is going. And then when things are happening where overspending is occurring, get involved, have a voice. It's important for you to be able to communicate. No, I don't want that to happen. No, that's going to affect me. That's going to rise cost. And also just being aware of fraud, waste, and abuse. Seeing doctors sometimes just do things by abusing the system. Just because they can do it doesn't mean it's a justified reason to do it. The other one, and last one before I go into the last section of this, is just using services when really we don't need to use services. You know, like for me growing up, when I had a cold, my mom would say, you have a cold. And I didn't go to the doctor. So I didn't go to the doctor for most minor things. Nowadays, if somebody even blows wind towards somebody, a lot of times they're like, oh, I'm sick, I gotta go to the doctor. Well, guess what? That raises up costs. Take care of ourselves. One of the major ways as a senior, 65 and older, is getting out, getting exercise, eating well, and managing your own health. It's so important because all of this reduces cost, creates profitability that goes towards funding Part A and Part B. Hopefully that helps. I'll be back in just a second. So what can be changed? You know, what are the things that we can control, that you can control, that can be changed? Well, one, there is going to be an increase to Medicare payroll tax slightly to extend Part A trust funds, okay? So when they talk about taxes being increased, you got to understand that when they do that, a lot of times what they're saying is there's a deficit based on not balancing out budget or overspending in areas of the government. So I would encourage you to be aware of that and go, hey, what's causing that to have an increase? You know, and I always say a fair tax is like sales tax in a state. Set a fair tax and everybody has to pay. If you earn $1, you pay a tax, and then that tax would allocate toward. But they don't ask me. But the increase in Medicare payroll tax slightly could be extended or increased to extend the Part A trust fund. Redirecting existing taxes like the net investment income tax back to the Medicare as intended. So here's the other thing about politics. A lot of times we're going, Right now, we're in the moment of the heat of the discussion or argument, not realizing what was the intention of this and what am I voting for. The net investment income tax was supposed to be extended to Medicare to offset costs, and it's been allocated towards a different direction. Addressed overpayments. This again to Medicare Advantage plans. Some say this could save billions. So, overpayment of things. Again, a simplified, standardized billing system. Original Medicare has a fee for schedule of what they pay for Part A and Part B services. It's standardized. And most of the time when you walk in to a doctor's office and you say Medicare standardized billing codes, are they simple to understand? They may say, sometimes, or there's complications, but for the most part, generalized Medicare's standardized billing codes are easy to understand. Then if you ask them, what about all the Medicare Advantage plans? Well, guess what? They all have their own coding system because they want to be the best at what they do, and they all want to have different coding systems. Well, the reality is what should determine the health plan's ability to be the best is their value-based care model, which you need to be involved in and experience yourself. But if they execute on a value care basis and then they had standardized coding, all the companies would have for a general doctor visit, it's code 001. And all of them build to that. Then Medicare and the allocation and the doctor and the patient, it would simplify, and guess what? There wouldn't be billions of dollars of overspent for overpayment because of billing issues with Medicare Advantage. So there's going to be legislation, there's going to be people standing in the gap to say, hey, this needs to change. You need to be aware of that. You need to be involved in that and let your voice be heard, because that just standardizing will help reduce just the complication of billing is such a problem. For you guys that have had billing issues for Medicare Advantage or Part C plans or Medicare prescription drug plans, or something that was supposed to be billed through your Medicare supplement, it wasn't billed correctly, if you're not dealing with an office like us that has a customer service department that can help walk you through the process of solving that, you need to be able to pick the phone up, give us a call and say, hey, I've got this problem, can you help me solve it? But the reality is, if we simplified things and made systems and processes easier instead of more complex, I always say the government gets involved, they complicate it. So the less complicated, the less overspending would happen. Guys, I'll be back in just a second to wrap this one up. So guys, let's just recap real quick. So a couple things you can do to make an impact when it comes to spending. Part A is funded by the trust fund, and being aware of allocations of money going towards that. Being aware of what's going on when it comes to your vote and your voice is so important. But also Part B comes from the general U.S. Treasury Fund and what you're paying in Part B premiums. And so just being aware of what's going on, and also realizing sometimes allocation of legislation that was passed for a good thing to help resolve reducing costs, is that money is allocated towards something else. Have your voice heard. Speak up, say something, vote, get out and make an influence with your impact, which is the ability for us to speak and us to vote. And then lastly, guys, one of the most important things I mentioned, and I didn't dive into this a lot, but I tell my kids this all the time. I tell people in leadership this all the time. I really have two businesses to run, my business and no one else's business. Well, it's my business, my personal responsibility to take care of myself physically, mentally, emotionally. I know that the probability if I take care of myself physically, mentally, emotionally, and spiritually, I'm going to live longer. My cost to cover my care long term is going to be lower. My encouragement for you, especially if you're turning 65, you're coming out of the workforce, get some processes in place to exercise, to eat well. If you're 65 and older and you've fallen off that bandwagon, get up, make a step towards improvement. Walk. Get around some friends, socialize, get some social activity, read, do something with your brain, activate your mental mind, activate your body, activate conversation with people, learn to be emotionally intelligent, grow as a person, and that's going to help lower your risk, which helps overall. If we did that as a nation, a lot of us may not be on social media, but like just me watching my kids grow up in social media, this huge movement, just making sure like, hey, get off your phone. Be active with your brain, read. My kids read. My daughters have always read. It's so hard for us to get stuck into a habit of doing things that actually cost us more money to maintain a lifestyle that if we were just active as people when it comes to our mental health, physical health, spiritual health, the areas that are important to you, get out and do something in movement, make your life better. Guys, until next time, have a great day. We'll see you soon.